hypertension, and so on. So really, what I want to do is that we had a little technical issue. We hopefully it will not continue, but I don't want to spend too much time talking. So I'm going to hand you over to the capable hands of Dr. Dolly. Dr. Dolly, hi, how are you doing?
I'm fine, and you?
Fantastic, fantastic.
Okay.
So how are we feeling today?
Oh, well,
Yeah.
I'm very excited to be here.
So the information, is it going to be something that people are going to need a pen and paper ready?
Oh, yes, yes, definitely, because we are going to dissect hypertension today. Just
Wow.
be ready.
Wow. Dr. Dolly, hypertension is quite common in Nigeria, isn't it?
Oh, yes, it is.
Wow. So you're going to share that information with us.
I would love to do that.
Wow. Okay. And guess what, guys? We also are ready to take your questions. We have online, I have my computer here, so I'll be checking some of the questions. And also, we have our one and only Mr. Marvel. He's going to be checking the Facebooks, the YouTubes, the Instagrams, and also the Zoom. So guess what? We're going to have a lot of information for you. And if you have any questions, please don't hesitate to send it by text, send it by typing it in. So thank you very much. And I'd like to hand over to Dr. Dolly. Dr. Dolly, over to you.
Okay. So, hello, people. It's a very warm welcome from me or from us in this studio to you out there. Today, our topic is going to be hypertension on your favorite program, Your $1 Billion Body. Again, I am your anchor, Dr. Dolly, aka Dr. D, and we're here to dissect hypertension and tell you how to prevent, and if you already have it, how to manage it properly. Now, let's go. Do you know that WHO, according to WHO, it says that hypertension is highest in Africa. The prevalence rate is up to 40%, while it is lowest in the US, with a rate of 35% for both male and female. So it will be a joy for you to get in here with us so that we can help curb this health menace.
Wow, wow. So 40%.
Yeah.
Is that just in Nigeria or is it in Africa?
In the whole of Africa,
Wow.
hypertension is highest in the whole of Africa. And then in Nigeria, it is endemic in this region. Yes, out of the 200 million people we have, 85.6 million people are living with hypertension as we talk now.
85%.
That's it.
85%. Wow. And would I be right in saying that some people might be living with it without realizing they have it?
Exactly. They just might do that because hypertension does not have a known symptom.
Wow. So that means that we need to ask, the question really is, what is hypertension? Because people out there might have it and they might not know.
Exactly.
So what is hypertension?
Well, hypertension, it is simply put, it is a consistent elevation of your blood pressure. Now, if your blood pressure rises on a one-off occasion, that's not hypertension. But when the rise in the pressure is consistent over time, that's when you're diagnosed of having hypertension. And then, what is hypertension? Listen, everybody has blood vessels running from head to the toes of any human being. And now, for the blood to be and circulate to every part of the body, it needs a certain amount of force to push it along the vessel. Now, when this vessel now, the pressure or the force pushing the fluid or the blood inside your vessel has now increased over time on a sustained level. That means that something is actually happening. There's a blockage somewhere. And the message the body sends to the heart is you need to readjust. And in the body, the heart readjusting and the circulatory system as a whole readjusting to this change results in things like raised high blood pressure, raised pulse rates, and all the rest of the symptoms you have when you have hypertension. Now, how do you know? In fact, before we go to hypertension, what is your normal BP? Averagely, the normal BP of any healthy individual should be 120/80. At that rate, the vessel or the force is pushing the blood through the vessels at this normal rate. No damage to any system. The respiratory system is working optimally. Now, when at any point in time you check your blood pressure and you get the systolic pressure to be greater than or above 140 millimeter mercury, and then the diastolic to be greater than or equal to 90 millimeter mercury. It is diagnosed as having hypertension. Now, this hypertension, you'll be wondering, what causes hypertension? Before we go to the causes of hypertension, we'd like to look at the types of hypertension. It's actually divided into two. We have the primary or the essential type, and then we have the secondary type. And then the primary type of hypertension consists of 80% of cases. And in this primary type, the cause is usually unknown or it could be familiar. Then, in the secondary type, it consists of 20% of the cases. And it is these 20% cases that have causes that we are now about to deal with, dissect it, and tell you how to prevent it. Now, we're dealing on causes of secondary hypertension. I take it again, causes of secondary hypertension. In this group, I broadly classified it into six different classes. The first one is renal causes. For those of you who will be wondering, what is the renal? What is the renal system? Renal system consists of your kidneys, your ureters, down to your bladder, urethra, where the urine goes out of the system. In other words, your renal system takes care of your urine, getting it out of the body. Now, in this system, you can have what we call polycystic kidney disease. It affects the kidney itself, and usually the person is born with it and starts manifesting with this disease as you get to middle age. At around 40, it's amazing, and you have been okay all your life. It starts coming. In that case, it not only comes alone, it comes with hypertension. Another type of renal cause that can also give you secondary hypertension is acute glomerular nephritis. The second cause, which is endocrine causes. Endocrine is basically the hormonal system. Here, if you have hyper or hypothyroidism, it comes with hypertension. Some pregnancies also can give you hypertension. Then, for women who take combined oral contraceptive, it's always in the leaflet that, hey, this thing can give you hypertension. Now, the three division also, the three system where also hypertension can be gotten secondarily is the cardiovascular system. This generally talks about your heart, the blood vessels that we earlier mentioned. Now, here, if you have increased intravascular pressure, it is going to give you hypertension. And how is this? Let me just break it down. Increased intravascular pressure can be gotten by high intake of salt. If you're taking too much salt in your system, when the salt is there, it attracts water. And this water expands the circulatory system, causing there to be increased intravascular pressure because the water is also increased. And this also gives hypertension, and it is more prevalent in Blacks, Africans, and in our society. Another type of cardiovascular cause that can give you hypertension is high cardiac output. Just like if you have the same increased salt, it also brings in more water into the cardiovascular system, expanding the vascular volume, and then giving rise to hypertension. Another one, number fourth point now, is neurologic causes. Neurology is all about your brain and spinal cord. That's all. Now, when the brain is disturbed, we call it stress. Acute stress can also give you hypertension, especially in Africa. So if you know this and you're aware that it can give you hypertension, then you will be willing to do something about it. Another one is sleep apnea. This is another advanced level of not sleeping at night. It can also give rise to hypertension. Then, how is blood pressure regulated in the body? This regulation of blood pressure is a whole gamut of topic on itself, but I'll just make it simple and compress it for you by telling you that it is basically determined by interactions of multiple genetic and environmental factors between the blood volume and the peripheral resistance. Let's leave it at that.
Wow. Wow. So just for the simple layman, because, whoa, that was heavy. That was heavy. Some words there I can't even try and read pronounce. But in terms of putting it to layman,
Yes.
I'm thinking, I'm watching the show right now, and I'm thinking, do I have hypertension? Are there any like layman things that you might look out for in terms of, oh, I'm feeling down, I'm feeling stressed, or I'm feeling, because they don't know, a lot of them don't know these symptoms.
Okay.
So I think, is there something that you can look at someone and say, you've got hypertension? I know that's too easy. That's too easy. But I'd love a world where I can look at someone and say, you've got hypertension.
Okay.
But then what would someone need to do to go and get checked? And why would they go and check? Why would they take that initial step to say, right, I need to go and get checked?
Well, if you're 40 and above, that's an indication for you to run checks. You have to know your numbers. You have to know your hypertensive number. That is how you know that you're taking care of your health. You're being proactive in doing that. First of all, your age. Second of all, if you start feeling something like tingling sensations on the palm, yes, tingling sensations, those minute symptoms that you just ignore, that's how hypertension comes. For other people, it can present with persistent headache all the time. I've taken Panadol, I've taken simple painkillers, but it is still persistent. That's when you know that, wow, this, I need to check this out. And then again, it can also come with sleeplessness. You have previously been sleeping well, all of a sudden, you go to bed and you can't sleep. You'll be restless through the night. It's time to check yourself. And then, if you know you are in the business where you were stressed all the time, you also need to run a check and see what's going on, what's happening. Apart from that, hypertension has no overt symptom. Your BP can rise steadily, silently, and quietly. If you don't check, it creeps up on you.
Right. Someone with hypertension can also have high blood pressure.
Yes, hypertension is the same as high blood pressure. Yes, exactly the same.
Right. Yeah. But why would they call it hypertension if there's no extra things linked to it? If it's not high blood pressure.
Yes, hypertension is the medical palate, while high blood pressure is us trying to break it down for the layman to tell you that your blood pressure is high.
Okay, I've learned a lot already. I'm so excited. I hope you out there, the audience, you're excited too, because I've learned something. Hypertension, that's made simple. Hypertension made simple. High blood pressure.
Okay, now, as we have now just concluded that hypertension has no known symptom. If you feel you're not connecting to your body is not what it used to be, please advise you to go to a hospital and get your BP checked out. Now, another thing is predisposing factors for hypertension. Like Mr. Tony asked me, what will I be doing? What do I see in you to say, it's like you have hypertension? Well, if you run a 9 to 5 job and you're inactive, the first thing is inactivity. You need to be active. At least have exercise 30 minutes every day, 150 minutes in a week. You need to move. If your job is the kind of job that don't allow you to move, you need to be there. Come, exercise your arms, your hands. Every 5 minutes you sit on your chair, get up, walk around, come and sit down. Inactivity is a predisposing factor, and I'm happy the Nigerian culture we are incorporating exercise, gymming, and all is really going to help. And if you're not yet up, please, after this program, do get up from the couch and move.
Feel like it myself.
Oh my God. Yes, yes. Now, the second predisposing factor is acute stress. Like I said, I actually have come across a patient who's very vibrant, a young lawyer. He just entered the court and was arguing his case before a judge brilliantly. All of a sudden, he slumped on the courtroom. Yes, he was rushed to the hospital, and the people who rushed him were like, wow, he was dealing with a very, very controversial case. Maybe he poisoned him, maybe he done that. We just ran a BP check. And so the guy's blood pressure was on the roof. So that is the kind of symptoms it can give to some people. So don't allow it to get to you. If you know that you are in a line of stress, please, please, and please be very, 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 very comfortable and know your hypertensive numbers. Very, very important. The third point is excessive caffeine intake. Yes. If you are a caffeine lover, you love coffee and all of that, that's okay. But if you take it in excess, of course, it's going to raise the BP. Because as you are on your table and you're sipping on your coffee, immediately you finish taking that coffee, your blood pressure rises instantaneously. Then over time it falls. Now, if you keep on binging on caffeine for a long time, it can overtly have effect on your blood pressure and rising it. Now, the fourth point, that is, we are still on predisposing factors. Don't get into step, please. Now, the fourth point is taking of excess carb. In other words, wrong nutrition. How do we mean by wrong nutrition? When you have so many of the oil we take, the cooking oils we have, some of them are made of trans fats, refined carbs. We don't want saturated fats. The body doesn't like it, and it gives it a hard time to digest it. And those fats are what actually will also go and block your blood vessels, so that when the body is pumping, when the force, normal force, the pressure that pushes the blood in the vessel is coming, is meeting resistance. And what the heart does, if it meets resistance, it increases force to overcome the resistance. In doing that, you resist your BP. Now, another one is excessive alcohol intake. Social drinking is actually good for the body, don't get me wrong. But when you binge on alcohol, that's when the problem starts. So, excessive alcohol intake predisposes you to hypertension. Another one is also taking drugs. When I mean drugs, I don't mean prescribed medications by your medical practitioners and caregivers. I don't mean that. What I mean is taking drugs, social drugs that you take to be high, like cocaine and all of that. Especially cocaine, it is known to raise the blood pressure if you keep on taking it for a long time. So to run away from high blood pressure, you need to run away from all those kind of medications.
Wow. So in terms of coffee, I take coffee.
Okay.
I didn't realize every time I take coffee, my blood pressure rises.
It does.
Why would it rise? Is it just because it's caffeine, or what is it? Is it something scientific?
Yes, caffeine.
That's it.
Caffeine can actually stimulate the smooth muscle, which is in the blood vessel.
Right.
Yes, it can stimulate it, make it constrict. Anything that constricts the blood vessel raises the blood pressure. Anything that dilates the blood vessel lowers the blood pressure. So caffeine is among the terms we call vasoconstrictors. It constricts the vessel and raises the pressure.
And carbs.
Yes.
Carbs. Is there a good example of carbs?
Oh.
Because some people say carbs and they don't know what carbs are.
Well, oh my God, I'm so sorry. Carbohydrates are carbs. Refined carbs are refined or processed carbohydrates. Those that have already been taken to the factories to process it into something, maybe like spaghetti, hot dogs, burgers, and all of that. Those are the kind of carbs that we're talking about. But naturally occurring carbohydrates, they are fantastic if you know how to prepare it well.
I suppose that's why you decided to get this program sponsored by Salad Master.
Exactly, yeah. Exactly my point. Salad Masters wowed me when I saw the cookware they use in preparing their yam. Yam is not cooked immersed in water, but cooked with steam. thereby dispatching the yam and leaving you with the real nutritious yam. Yes.
Well, we'll talk more about that. I'll talk more about that later.
Okay.
Yeah? So thank you very much. So over to you again, Dr.
Okay. So what I'm saying is that if you are already diagnosed with hypertension, as most people in Nigeria are, because everyone in 3 persons you meet on the streets, they have hypertension. It is that common in this climate. So if you are already diagnosed, what we need to do on this program is to help you manage it well. The first thing you have to do is to visit your doctor. Don't do home medication, don't do that. Just go to your caregiver and see your caregiver. If there's medications prescribed to you, please do take it regularly. Don't skip it. Once you're commenced on antihypertensive drug, it is for life. Don't say, I measured it today, it is normal, it is 120, because you know the numbers, I'll take it. No, you don't do that. If your doctor needs to taper you off those drugs, he knows when to do that. So please keep on taking your drugs and follow instructions. The second thing is do exercise. Inactivity and hypertension, they don't go hand in hand. And some experiments that has been carried out also say that if you exercise consistently, that's the key word here, consistently for 30 minutes every day, it can lower your BP it can decrease your BP as much as 8 millimeter mercury. It can. So maybe like you were 128. Of course, that's not hypertensive. I'm just giving an example. If you're 128 millimeter mercury, your systolic blood pressure, you exercise 30 minutes every day for a week, it will knock up the 8 and you have 120. That's how good exercise is to high blood pressure. Yes. Now, the second one is stress management. You need to manage your stress because you already diagnosed with hypertension. So if you still stress the system, it's going to be worse for you. So if you are a hypertensive person and you know that you're hot-tempered or stuff, keep calm, walk away. That's the advice. Don't trigger yourself. Now, the other thing is, the last but not the least, in those who are already diagnosed with hypertension, regular checkup in a hospital with a cardiologist is very, very important.
Wow. So someone goes for a checkup.
Yes.
Let's say, for example, you have some of those tingling sensations, and your blood pressure. You just feel when your blood pressure is high.
Yes.
This is one thing I always wonder. When your blood pressure is high, without testing yourself, how would you know your blood pressure is high? What would you feel if your blood pressure is higher than normal?
Nothing really.
So you wouldn't feel like dizzy?
Nothing really.
You wouldn't feel lightheaded?
No,
So
just be a little bit tingling sensation and then headache. Most people come down with headache, yes, and it's persistent.
Really?
Yes.
Because sometimes I have headache.
No, if you take the headache that you have and you take analgesics, painkillers, and it goes, that could be stress, that could be tension headache, that could be any kind of headache. Yes, but if you take it and it persists, and usually you have these headaches in the morning when you have not been stressed. The tension headaches come as the day progresses. You know that, oh my God, this person is giving me headache. But in the morning, fresh, no confrontation, you're at peace, and the headache returns, and you know, I have to do something at this point.
Right.
Yes. Okay. Now, if you are disease-free, you are not yet diagnosed with hypertension, this is for you. This program is here, your billion-dollar body is here to make sure you don't come down with it. Because we already know what you have to do and how you have to do it so that you don't come down with hypertension. The first one is look at your nutrition. Like we talked about yesterday, you have a food strategy. You don't just eat anyhow. You don't eat what you see if you're planning to prevent diseases in your future. What I always say to people is that your future is yours. Plan to be there. Plan to arrive in your future healthy and happy. Plan to be there. It's your future. So you take charge. First thing you need to do is have 5 servings of fruits and vegetables every day. That is WHO, World Health Organization recommendation. You have 5 servings of fruits and vegetables every day. Then incorporate nuts into your diet. Do incorporate nuts into your diet. And then laugh often. Yes, laughter has medicinal advantages. And this is one of
Maybe that's why I have.
those. Yes.
Yeah, I laugh a lot,
Oh, yes.
but I smile.
Oh my God, that is so good.
Yeah.
That's
I'll keep laughing.
it's
Keep
medicinal.
laughing, keep laughing.
Yeah. And then another point is be active. If you don't have hypertension, have time for exercise, be consistent about it, and keep at it. With that, hypertension runs away. Now, another point I'm going to make here in preventing hypertension for those who don't have it already is getting enough sleep. It is very, very important. At least 7 hours a day, you need to get adequate sleep because in sleeping, the body actually rejuvenates itself for another battle the following day. So it's very important we sleep. Now, this another point I'm going to make is about your emotions. Like every human being, we all have challenges. And how you handle the challenges determines what happens to you, even your health. It determines what happens if you're going to have hypertension or not. Now, if those negative emotions come to you, don't deny it. Don't bury the emotions. Don't project it to another person. Don't rationalize it. Don't go to the gym and say, I'm sweating. No, don't sweat it out. Don't meditate about it. Don't smother those emotions with comfort foods. And last but not the least, please don't drink it away. If you are not feeling good, write it down. Process your thoughts. Work through it. Why did I feel this way? What happened that I'm feeling this way? And now you deal with it. If you bury the emotions inside, it's taking its toll on your blood pressure and over time.
Oh, wow. So really, emotions have got a lot to do with it too.
A whole lot.
Yeah.
Yes.
Okay. So what else can we say about what else do we have?
Wow. There's a whole lot we have about them. There's a whole lot we have. After being, if you do all these things, look at your food. In fact, you have to even binge on fruits. There are fruits that are known to contain what we call some of them flavonoids. And those flavonoids go directly to the blood vessels and dilate it. By dilate, I mean expand the blood vessel. And if you expand it, blood flow is more at ease. That way, your blood pressure is decreased. One of the wonder fruits I know that works wonders for patients of mine are seen is beetroot. It's not just beetroot, the red one, it is very good for high blood pressure. Then, if those of us who are here who can get pomegranate is good. It is researched in America that if you drink pomegranate juice every day for 30 days, that your BP is going to have a significant drop. So why don't you try that? You have nothing to lose. Now, another fruit that is good or herb is ginger. You also have celery, cucumber, and bananas. Bananas are very high in potassium. So, which means when you binge on salt, you have so much salt intake in you. When you have potassium in there, it excretes, it helps the kidneys to excrete the sodium more easily. Now, we've also talked about cooking oils. In cooking oils, of course, nobody will tell you you don't need to fry, but you do need to fry certain things. And when the need arises, the type of cookware you choose to fry with matters. And the type of things you are using to get your oil matters as well. So when you use oil, try and make sure you use oils that contain omega-3 polyunsaturated fatty acids. It is highly advised. If you don't remember the polyunsaturated fatty, in the long English, omega-3. Go to shops, look for oils that contain omega-3. They're fantastic for the heart. And whatever is fantastic for the heart is beautiful for blood pressure. So you go for salmon, mackerel, sardines, they have high contents of omega-3 and they're good for your heart.
So cooking oils, with our audience here, what type of cooking oils would you advise? I mean, obviously, in Startup Master, we show people how to fry without oil. I think that's one of the things that impressed you the most.
Oh my God, because it's if people actually cook with Salad Master's cookware without oil, the way they cook it, and I've seen it being done, I bet you Nigerians' rates of hypertension will decrease.
Wow. And the nutrition in the food, does that have an impact in terms of hypertension? The nutrition that we keep in the food, does that have an impact?
Of course, because like I just mentioned, the fruits, the vegetables, if you cook them and overcook it, and then the nutrients are lost, it can't do what it is required in the blood vessels. So when you eat it, it's the loss for your body because it's not adding anything to it. So you are feeding your body, but because of the processes and the way you cook it and the cookwares you use, you lose those nutrients, and you're still big or you're malnourished. And when you're malnourished, over time, the body will compensate for the malnourishment initially, but over time, it becomes overwhelmed.
Wow.
Yes. So that's it. Now, in covering hypertension also, we have what we call, there's a DASH, what we call DASH kind of program for eating. In DASH, it tells you to increase your intake of vegetables, nuts, eat low carbohydrates food, increase your fiber intake to 40 grams every day, and then substitute healthy foods with the unhealthy ones. There's always something to use to substitute so that you still get your comfort food and the foods that you crave, and then do it in a healthy way. An example, I'll just give some few examples. We have, like, instead of getting full cream milk as an adult, you can do skim milk. It will give you the same thing with lesser disadvantages. Instead of you doing sweetened yogurt, you can just go for Greek yogurts, Greek plain yogurts. Then, instead of going for ice cream, there's this one we call nice cream, in which you blend fruits, refrigerate them, and they come out looking as fantastic as any ice cream does.
Really?
Yes.
Nice cream.
Nice cream. Yes.
Nice cream.
That's what
it sounds nice too.
Oh yeah, and it looks
ice cream, nice cream. I think I'll choose nice cream. Everyone, nice cream.
That's
Don't
right.
Nice cream. Okay.
Nice cream is very, very important to you, and because it contains all the fruits, just blend it, refrigerate it, and bring it out. That's ice cream.
So this would be good for children too.
Oh yeah.
I think parents out there have problems with their children eating healthy.
Yes.
I think if they said nice cream, I think nice just has the N at the beginning, isn't it?
That is it.
So ice, take the N off. It's ice, isn't it?
That is it.
So this is extra.
Yes, that's
healthy.
extra healthy, and then they still have the nourishment.
Fantastic.
Yes. So now we'll be taking on complications of hypertension. Most of the time, if you have hypertension and you are not going for checkups, you're not regular on your medication, you're not exercising, and you're eating the wrong kind of food, it can get complicated. And usually, we don't like hypertension getting complicated. So the first complication I will take is atherosclerosis. Atherosclerosis is a disease of the blood, which means that when the blood vessel is flowing and there's pressure to it, everything we eat passes through the vessel.
We're in Nigeria, so we're
Okay. So atherosclerosis is fatty saturated fats clinging onto the vessels on the wall of the vessels, so that it causes blockage when the blood is passing. And that is very, very bad for health, because it needs to be patient for blood to be circulated throughout the body. The second complication of hypertension is hypertensive cerebrovascular disease. The name of hypertension can get complicated and go to the brain because the vessels in the brain to either hemorrhage. And when this is done, it has stroke. And stroke is so bad that it paralyzes the whole half of your body. It is very possible. So, what you do to avoid this is to prevent hypertension. Another complication of it is hypertensive heart disease. Of course, when the heart is pumping blood against a very high pressure in the vessels, over time, the heart becomes weak. The heart becomes very large. And if the heart is large, the irony of it is that as the heart is getting larger outside, because it has what we call myocyte muscles, these muscles only expand. So as it's getting bigger outside, it is shrinking the space inside the heart, what we call the heart chamber. And when the heart chamber is getting smaller, the amount of blood that is pumped out to the systemic circulation is reduced. And when that goes on for a long time, the heart backs up. Usually a very bad sight to see. The other one is hypertensive encephalopathy. What a hypertensive encephalopathy is when you have hypertension and you have increased intracranial pressure in the head. It's crazy. You don't want to see someone who has this. It's like their head is breaking into two, but they are there. They want to bang the hell of the head on the wall just to be free. It's a frightening sight for anybody to see. I saw it once when I was a medical student and it wasn't a good sight. And I don't want anybody who is listening on this program to come down with one. So please, hypertension must be prevented. Another complication is left ventricular hypertrophy, just like what I explained in hypertensive heart disease. Ventricle is a part of the heart, the lower part of the heart that does the pumping. Now, you're pumping the blood against resistance. Over time, the heart gets weak. And the heart's muscle, the bigger it gets, the weaker it is. It's an irony, but that's the way it works. And when this happens, it's usually it has very bad prognosis, very bad. The last but not the least complication on my list today is renal disease. Of course, whenever there's hypertension, the first thing we look at is we are trying to prevent complications of the kidneys. Once all the water you make, we take water every day. The intestine, our body produces 4 liters of water every day on its own. So imagine this water is not passed out. Before you know it, you're as grown as whatever. That is what complications of hypertension can lead to. So, with all these things I just enumerated, there's no gainsaying the fact that hypertension is really, the ramifications are much. Let's put it like that. So, it is better to avoid it. And when you come down with it, with the good, healthy attitude to health, and you adopt a healthy lifestyle in eating, in exercising, and avoiding certain things like alcohol, not too much coffee or caffeine, and all of that. And then no social drugs like cocaine, heroin, and all the nuts. You will actually manage hypertension very well.
Wow, thank you, Dr. Zoran. Thank you for the information.
Oh,
well,
yeah.
What I say is just listening to the information. I think most of the people out there will probably say, okay, hypertension, okay, if I have it, then how do I treat it? Can I treat it? I know we talk about the combination between the medical industry and the nutrition side. And like I said to you yesterday, that sometimes there's a conflict.
That's
There's
right.
a conflict between the two of them.
Yes.
But you have managed to bridge the gap.
Yeah.
So what we want to do is we want to just find out, firstly, if I have it, can I treat it naturally? Is there any natural way of treating it? Or do I have to combine the medical approach and the natural approach? And hopefully, when the natural approach is working, then I let go of the medical approach. that's just a naive question.
Yeah.
But I just want to ask you that question.
Okay. All right. That's a great question. Really, really, really well thought out question. I like the question. But actually, there shouldn't be any gap between orthodox medicine and the natural healing. They should work inside each. In fact, they were meant to work together as one because they each complement each other. But now, when you have what we call elevated blood pressure is the blood pressure is high, but the diagnosis of hypertension is not yet made. That is when you can actually say, yes, I can revert curb hypertension with just natural means. But when you are already diagnosed with hypertension, you need to go to the hospital and meet a qualified medical doctor to treat it. Remember, at the beginning of this program, I said that 80% of hypertension can be primarily caused. In that primary cause of hypertension, the cause is unknown. We have two types of hypertension: primary or essential hypertension and secondary hypertension. So if you are staying home trying to treat essential or primary hypertension, thinking you have secondary, you might run into trouble. So the best thing is to take it to the health professionals who will categorize it well and handle it appropriately.
Okay, I think half of my question is answered.
Okay.
The other half I'm just wondering.
Okay.
So we take it to the medical profession. Yeah?
Yeah.
Now I know in a lot of medical schools, and a lot of practice, they don't necessarily learn too much about nutrition. Yeah?
That's right.
So you find that you take it the medical way, and obviously the medical way is obviously they have their way, which is really repairing the problem.
That is it.
Now, from what I've heard from the medical way, is that you repair the problem, and then you now ask them to live a different lifestyle. Yeah. So that means that by asking them to live a different lifestyle, it means you're asking them to change what they eat and change how they live. So what I'm saying is there a way? You've answered half of it. Is there a way that we can eat while we're going through this medical process?
Yes.
We can eat things to try and help the medical process.
Yes,
Yeah?
yes, yes. I said it before. Incorporating nuts into your diet. Nuts are very fantastic with lowering the blood pressure. When you incorporate lots of nuts, make it a conscious effort to look for nuts. Maybe in your breakfast, or lunch, or dinner, or even a snack. You can snack on it. That's very good. And then fruits. Fruits, actually, for me, I call it one of the miracles of the world because what it contains, actually, especially the red beetroot, can actually lower blood pressure. It's been proven time and time again. So, when you are on antihypertensive drug and you're eating this kind of fruits, nuts, and foods, and then avoiding those kind of cooking oils or vegetable oils when we use at home to fry, when you avoid all of that, of course, you're going to come out a lot better than the person who is diagnosed and is not helping himself with food and vegetables and all of that.
And that answers my question. I mean, that's great. And that's one of the reasons why we call this show the $1 billion.
Oh, yes, your $1 billion body.
And I think what in a nutshell we're saying is like the statement that they say you are what you eat. So being hypertensive,
yes,
is that also a result of what we've done during the time of our life?
That's it.
Yeah, and is it also linked to you are what you eat?
Yes, exactly. If those people who live their life without really paying particular attention or proper attention to their health and lifestyle usually come up with hypertension by the time they reach middle age. So if you want to avoid hypertension, it starts now. It starts today. By being active. You can't lie on the couch all day and expect to get up and be all right. No, the body needs to be active. It is meant to be. That's the way it is wired, and it has to be like that. Then the body by default already craves for nutritious food. You can't eat what you see, no, and come clean of hypertension. You eat what you need, not what you see. Everything that is edible is not nutritious. So we don't have to go that route. Another thing is lifestyles, cigarette smoking, binging on alcohol, taking of cocaine, marijuana, and all of that. All these things affect the circulatory system. And so if you have been living like that for a long time, some people, you look at this person and say, hey, what about this person? No, you don't look like that because you don't know the amount of time. Some people started smoking at the age of 15, some started at 25, some started at 30. So the end result for all these people might not be the same. So if you want to meet yourself in the future happy and healthy, start today.
Fantastic. So as we said, you are what you eat.
Exactly.
Yeah? And also, life, like I always say, life is not about illness, it's about wellness.
Exactly.
And I think it's important for us to understand that we're all going through life.
That's right.
But what journey do you want through life?
That's right.
And I think what we're saying here on the show is that learn more about your condition.
Yes.
Get checked up. Now, if you get checked up sooner rather than later, it might be easier to use the natural way.
That is it.
Yeah. But when it gets to the point where it's deep,
the body is overwhelmed,
then we're going to have to get medical and the natural way to overcome it.
Yeah.
And also, what I'd like to say is thank you very much, Dr. Dolly. Thank you very much on that. I learned a few words, and I also need to try and pronounce some words that you mentioned.
Okay.
Yeah? But what I'll say is, what I've picked up from here is that hypertension is linked to high blood pressure.
Yes.
Yeah? The layman's word is
yes.
high blood pressure.
Yes.
High blood pressure is also linked to a number of things in terms of our diet, in terms of our lifestyle, our exercise, all these things. So I've learned those kind of things. And I think you, the audience, I hope you've learned that too.
Yes.
And which means that we have to really look at what we're eating. And we also have to mix it well with our exercise.
That's right.
And then also, if we're looking at what we're eating, in Salad Master, which is the program sponsored by Salad Master.
Yes.
And you obviously are Salad Master customer.
Yes.
Yeah, exactly. So guess what? We say in Salad Master, we say people eat for 3 reasons. And what the first reason we say is for pleasure.
Yeah.
And I know some people behind the camera, you eat for pleasure.
That's right.
There's a lot for pleasure. And the second one's for energy.
Yeah.
And the third one's for nutrition. And I think the third one is really what this is all about.
Exactly.
And that's what we focus on in Salad Master.
Yeah.
So I'd like to also thank Dr. Dolly again and thank the sponsors of this program, Salad Master, and also thank you for the Excel region and all the dealers in the Excel region for sponsoring this program. I know we've got another program coming up soon,
yeah.
and we'll keep you updated with that.
Yeah.
And all we say in our program is, you know what? The $1 billion body. Yeah. This body is so priceless. So priceless. So priceless.
Oh my God.
So priceless. Everything that you have, audience, everything. Think about it carefully. Everything that you have is because of this body.
Yes.
Is because of this body. So guess what? If this body falls ill, that's the only time you know it's priceless. Because if the money that is required to pay for repairing it, if it's not in the bank, what do? We start selling our jewelry. We start selling our cars. And the reason why is because you know that if you can repair this body, you can replace all those items.
That's right.
So let's have respect for the body. Yeah. And also let's get checked up. Especially, you mentioned the age, like 40 plus.
Yes.
When you get to 40 plus,
you just need to walk into a hospital and get checked up.
Fantastic. So really, guys, I'm saying to you here, all the way from the office in Victoria Island, we're saying to you, take care of yourself. Yeah, life is not about illness; it's about wellness. Live the life you deserve by taking care of your health and eating the right nutritional food. And Dr. Dolly is one of our ambassadors on Salad Master.
That's right.
So
right.
thank you very much, Dr. Dolly.
Okay.
So any last final words, Melissa?
Oh, yes. Viewers, I want to see you next time in your healthy set. Stay blessed.
And watch out for the next program. The next program is coming soon. Next program is coming soon. Look at the YouTube channel and look at the Facebook channel. Subscribe, subscribe. If you're on YouTube, click subscribe so that you can be alerted whenever the program is coming. Marvel has some questions. Marvel, are you there? Marvel, are you there?
Yeah. Hi, Dr. Dolly. Thank you very much. Powerful information. Lots of people are connected, and we have some quick questions for Dr. Dolly. I have personally learned a lot tonight, and thank you, Mr. Tony, as well, for those powerful questions you asked on behalf of the viewers. Dr. Dolly, someone is asking, you mentioned about sleeping, and they've had some challenges in sleeping, I mean, a couple of days. What do you recommend? What can they do? That's the first question about sleeping. And the second question is, would you want to take it one after the other, doctor? Or you want me to just take all of them for you?
Okay, take all of them. I'll take it after you. I'll take the questions when you're done.
Okay, right. Now, the second question is, would you just kindly do a quick recap of the foods that can help lower blood pressure? Yeah, that's the second question. And the third question is the doctor saying that medication is for life? Kindly explain. Are you saying medication is for life? Kindly explain. So those are the three questions we have from our viewers right now. Dr. Dolly, over to you.
Okay, thank you, Marvel, for the questions. The first question is, a patient or a client says, I haven't been sleeping properly for some days now. What do I do? My advice is try, first of all, to make the place you sleep very conducive. If there's any stressful thing that is going on around you at the moment, try to deal with it. Make yourself as comfortable as you are and don't bring work to your bedroom so that when you come in there, you know that this is for sleep. If you do all these things and it's still not coming, I advise you consult your doctor. All right. So the second question is the fruits or the food that can help with high blood pressure. Well, first of all is nuts. You have your cashew nuts, you have your tiger nuts, you have your almond nuts, you have even the groundnuts, our local groundnuts. Those are nuts. And then again, you have some seeds as well. You incorporate it into your diet. There's so many eventful ways to do that. You can put it in your oats, your cereals for breakfast. You can snack on it. You can use it for brunch. You can even incorporate it in your bread, cake, and all of that. You can even grind it and incorporate it into your smoothies. Those are the ways in which you can get it into your system if you don't have allergy for nuts. Another one is fruits like beetroot. We have gold beetroot and all, but I am particularly talking about the red beetroot. It works like wonders for hypertension. Another one is apple, also the red apple. Ginger, celery, cucumber, and bananas. Bananas are very, very good because it works against salt intake. So it is very good for you to binge on all of these. It helps with blood pressure. Every day, WHO recommendation is have fruits and vegetables 5 times in a day. You need to figure out how you're going to incorporate that. Some people blend it all in a bottle of smoothie and drink it and sip on it all day long. Some people carry it on side boxes along them in their cars, offices, and then snack on it as the day goes by. All these things is being strategic about your food, knowing that you're not just taking your food for just medicine, you're taking it for nourishment and disease prevention. And the last but not the least question is...
Actually, just sorry, you come on me. I've got two questions out of that question.
Okay.
You mentioned another fruit.
Okay.
That I think it was pomegranate. That
Yes.
you said was an amazing.
Pomegranate. It is very good. And the juice works like wonders.
Right.
It does. It does. I've seen a patient drop like 10 millimeter mercury from his increased BP just by taking this juice for like a month. it does work.
Another thing, another question, because I'm seeing how this prevention and this trying to reverse this lifestyle disease. But one thing I'm wondering also is that all I'm seeing is vegetables, and all I'm seeing is fruit. I'm not seeing much meat. And you know, in Nigeria,
Oh, yeah.
they like
They love
meat.
meat.
So, and I'm hearing like you eat beetroot, you have apple, you have
Mhm.
celery. Where's the chicken? Where's the beef?
Oh my God.
Where's the suya?
Oh my
Where's all
God.
these things that?
Yes, yes. That's a very, very good point. That's a very good point, Mr. Tony raised. The meats, yes. Now, about the meats, if you're already diagnosed with hypertension, I advise you really, really reduce your intake of red meat. But there are a whole lot of others you can eat. You have the fish, you have the chicken, and you have turkey. But in doing that, you either skin the chicken and turkey, or you use Salad Master's cookware, the one I love, they call Bad Boy, to fry your chicken without oil, so that the oil in the skin drains out and ends up frying the chicken. So that way, you still have your chicken for the back, and then you don't still get the such unsaturated fats that we avoid. So that's it. So, and then again, about the meat, the person can have snails as well, mushrooms, and all of that. Those can be.
But your general, from what you're saying, generally,
Okay.
is that reduce the meat.
Yes.
Regardless, you're just saying reduce the meat.
The red meat.
Yeah, the red meat.
Yes, red meat.
Generally meat.
Yes.
Yeah.
And then again, the person can still have lamb. Lamb meat, it's okay. Well, I don't know about pork. Pork should also be reduced. But red meat, totally reduced. Yeah.
Because you know, I've heard a lot of diets
Okay.
out there which are vegan
Okay.
and or they're vegetarian.
Okay.
And from what I've seen,
Yeah.
apparently they have better results than quicker and
Yeah.
more permanent results if you can get away from the meat. Have you heard of those?
Yes, I have heard of it. I have, because basically they do so well because most of the diets they do for vegan dieting is all about plant-based. Plant-based, they're wonderful. Then, but medicine advises all parts or all classes of food should be incorporated in a diet for it to be balanced. Yes. So a little of that meat, not totally avoid, but just a little for you to get all the nutrients you need.
Okay, okay. I think you had one more question.
Yes. I have one more question. The question is kindly talk about when you have hypertension and you're on medication, is the medication for life? Well, once you're diagnosed, see, there's a difference between hypertension and elevated blood pressure. Elevated blood pressure is episodic. It can be a one-off thing, elevates and comes down. But if you have hypertension and a doctor tells you, Madam, sir, you have hypertension and I am placing you on this medication, you are not allowed to go off the drug. Unfortunately, it is for life.
When you say for life, if we say like we have vegetables and because you say high blood pressure,
yes.
You say certain vegetables can help lower
yes.
the blood pressure.
Yes.
So when we say for life, what if they're eating vegetables and what if they're seeing results of their blood pressure lowering? Because I've heard doctors say something is for life. Like for example, there's been issues with people that are diabetic.
Okay.
And they've literally been taking insulin for 27 years.
Okay.
And really, it really was a life sentence.
Yes.
But then suddenly, by going through a certain program, then suddenly they found that the body was given the insulin at the right time.
Okay.
So I think, can you qualify?
Yes, I can. Actually, I love this question because it's very, very stimulating, and it's also going to educate a whole lot of people. Now, when you are talking about a particular disease, you look at the mechanism of action. How did this disease happen in the first place? Now, when we say that you have hypertension, which means the body, mainly the heart, has tried to compensate been safe for the high pressure coming. And as if you remember, one of the complications we dealt with here is left ventricular heart enlargement. When the left ventricle is enlarged, is used to beating against. Let me give you this analogy. You have okay, let's say that this is a house, this is a water channel, and water has been flowing through it, going through it normally. All of a sudden, something like a log of wood, it's placed in the waterway. Now, for the water to pass, it has to increase the normal pressure it was using to pass so that it can remove the obstacle from the way and continue on its journey. Now, after so much, the log of wood has stayed for a long time in the pathway, and now you remove it. The water passing there has already gotten used to this very increased pressure in relation to what it used to be. Now, the water passing there is being controlled by the heart, and the heart still sees it that the obstacle is still there even when it's removed. So, and the heart over time has already gotten bigger and bigger. So it is now the work of the heart is being augmented by those medications. Now, if you totally remove yourself from taking the medications, although you're eating right, the damage has been done, let's say it that way. So you can't remove that. So the best thing for hypertension is prevention. If you have it, you will need to be on medication for antihypertensive for life, because the heart has already gotten used to that high pressure, and the structural changes it has undergone cannot be reversed. That is why. But in the case of insulin, insulin is a hormone that is produced by the pancreas, which is an organ that is still, the organ is still intact. There's no structural damage. It's just like saying, if I don't feed this body well and I start today, that's okay, nothing is damaged. If this hand is burnt, even if I feed well, the damage is there. That's the difference. So, in order not to have the formation of burning, don't go close to fire. That's the only thing. Because even when you eat well after burns, the burn scars are there. So, in order not to get this scar, don't go close to the fire.
Okay. But okay, I just want to ask another question, if you don't mind.
Okay.
Because I'm very interested in this topic, and I'm very interested in the fact that you say for life.
Yes.
But what I'm also interested in is there are levels of hypertension.
Oh, definitely.
Yeah. So the levels of hypertension, that we have.
Yes.
Surely there are levels which, to be honest with you, if you got to this level of hypertension, it's maybe lower risk. And if you got,
yes, you're right.
And then this level is it's like you're at risk or something else. And then there's a high level where, so is there a level that you can be diagnosed with hypertension? And if you do the right thing at the right time, that you could now reverse. And remember, when I say take yourself off medication, I'm not saying take yourself off medication. What I'm saying is that you can pursue a diet, and you can eat the right kind of foods, and then the doctor can see the results, and the doctor is the one that will either reduce your medication or say you no longer need to be on it.
Yes, definitely. If your hypertension is classified as mild, moderate, you actually can work on it. And then, in partnership with your doctor, not excluding your doctor, in partnership with your doctor, your medications can really be reduced up to 1. And sometimes, over time, because of the healthy way you're living and your hypertension has been consistently low, indicating that you're doing something right, and the pressure, and at this point, there's no damage that is already done to the heart, no structural damage that's done to the heart. I think you can be tapered off drug. Yes.
So there's still hope.
Yes, there's still hope.
Guys, there's hope. There's hope. So guess what? That's what I wanted. I wanted hope.
Oh my God.
Because I just don't like being given a life sentence.
Yeah.
I like to kind of like have, look, if I've been diagnosed with hypertension, if I do the right thing or my doctor says it's working,
Yes.
then just that means I break that life sentence.
Yes.
Yeah? So that's what I'm saying. Yeah.
Yeah.
So you as doctors also, I know there's a bridge you're crossing at the moment, and you just want to, you have to kind of take one hat off.
No, the thing is, we know about mild and moderate hypertension, and we actually don't discuss it with patients because most of them will take matters into their hands and stop the medication at the point they don't need to
No,
stop
they shouldn't
it.
do that.
And then they would have spoiled everything they have been doing right. So that is the way we don't encourage them to taper off the drug on their own. If there's need to, your caregiver will put you through.
Right. So go and see your doctor. Go and see your doctor. If you feel like you've got these symptoms, go and see your doctor. And if your doctor says you've got hypertension, then just start eating right. And ask your doctor to check you on a regular basis to see if you can come off this medication.
That's right.
Am I right?
You're right.
Okay, great. So Marvel, is there any more questions before we wrap up? We've had a long one. Those questions.
Thank you very much. Thank you very much, Dr. Dolly. That was precise. We don't have any further questions, and everyone is satisfied with my answer. Thank you so much.
Right. So thank you very much. Thank you very much, everybody. Remember, we are here sponsored by Salad Master.
That's
and you know what? Why I'm here is that I'm trying to make sure that we don't have a sentence in medicine.
No,
we have a solution. Yeah. A hope and a solution.
That's right.
Yeah. And when I say a solution, with the advice of your doctor.
That's right.
Yeah. So we would never tell you to come off medication. Well, whoever put you on the medication is the one that should take you off it or give you advice to take it off. And they'll only take you off it if your body is starting to work and do the right thing. Yeah. So really, that's really the message that I've got here today. And I'd like to say thank you again for our sponsors, Salad Master. Thank you again, Dr. Dolly. You've been amazing. We're looking forward to the next program. The next program, I believe we have a holiday, we have a break next week. And we have the next program the following week.
Yes.
So guys, look out from 2 weeks from now on a Thursday and on a Friday, you will have the next 2 sessions with Dr. Dolly. And if you're out there and if you're listening right now, if you have any kind of topics that you want Dr. Dolly to cover, please send them in between now and next week. That's why we have the gap, to give you a chance to send you, and then we'll select 2 major topics and deal with a few minor topics. Am I right, Dr. Dolly?
Yes.
Yeah. So I'm here. This is me, Tony, reporting from the Salad Master Excel head office in VI Lagos. And we're, by the way, anyone that's interested, we're cooking tomorrow. We have a cook school tomorrow. So anybody that's interested, send a message to Marvel. The cook school is healthy. It's healthy. I don't know. We're doing some Nigerian pancakes, if I remember right.
Oh my God.
We're doing some Nigerian. Can you imagine?
That's the substitution we're talking about.
Exactly.
Substitute.
I don't know what other dish we're doing. I can't remember the other dish. But the other dish is a Nigerian soup. I don't know. But guess what? If you want to know more about that.
Soup.
Oh,
yes.
Which one?
Cross Riverian soup.
Cross Riverian soup. You know, It sounds nice already. Guys, it sounds nice. And guess what? If you want to know more about Salad Master, leave a message. Guess what we're doing? Because of Dr. Dolly, we can come to your home, or you can come to us, or we can do a virtual just like you're seeing today, and you can see how we're able to preserve our nutritional value in our food. Remember, it's 93% nutritional value retained. And why? Because we want to use that to boost our immune system.
Yeah.
And why are we boosting our immune system? Because we know what's around that. It's invisible. You can't see it. So therefore, you need to do something to yourself.
Exactly.
So there are 3 things there going. We're coming in 2 weeks' time. We'll be back in 2 weeks' time. We've got the cook school tomorrow, the virtual cook school tomorrow. It's going to be nice, healthy Nigerian food. And guess what? What else? You can book yourself a free virtual presentation today. You can book it today, and we can be doing it online, or when we come to your home, by the way, we come protected. Protected. Right. We have our gloves, we have our masks.
We're health conscious.
Exactly. We're protecting you also from us. Right. Yeah. So thank you very much. And in Salad Master, we say medium, click, low, and we go. So what we want to say to you is medium click, low, and we go. So thank you very much, Salad Master. Thank you very much, everyone. Thank you very much, our sponsors, and thank you very much, Dr. Dolly.
My pleasure.
Medium, click, low, and we go. Yeah. Medium, click, low, and we go. So thank you, Dr. Dolly. Thank you.